Today, we're talking about tetanus. It's a condition where your body's off switch completely breaks, and it all boils down to one really scary question.
Seriously, just think about it for a second. What would happen if your muscles could only turn on, but never ever turn off? The signal to tense up works perfectly, but the command to relax, it's just gone. This isn't some hypothetical scenario. This is the grim reality of a tetanus infection.
So, where does this whole nightmare even start? Well, it's not some exotic virus from halfway across the world. The enemy here is microscopic, it's everywhere, and it's literally hiding in plain sight, right in the dirt. Meet the bad guy, Clostridium tetani. This is a bacterium, and it loves hanging out in the soil. It's also anaerobic, which is just a fancy way of saying it hates oxygen. So where does it thrive? In places like a deep puncture wound. But here's the kicker. The bacteria itself isn't what's so dangerous. The real problem is the incredibly powerful neurotoxin it starts pumping out once it sets up shop in your body.
Okay, so this is how the invasion goes down. It all starts with something as simple as stepping on a dirty nail or maybe having a wound that won't heal right. Then, for the next week, maybe two, silence. That's the incubation period. The bacteria is just quietly multiplying, releasing its poison. And by the time you even start to feel the first symptom, that toxin is already deep in your system and on the attack.
And this, right here, is where the hijacking starts. See, the tetanus toxin doesn't just make you feel sick in a normal way. No, it gets in there and it completely rewires the communication system between your brain and your muscles.
So, what's its target? It's incredibly specific. It goes after something called inhibitory neurons. Just think of these as the off switches in your spinal cord. Their entire job is to send the relax signal. They're what lets you, unclench your fist after you make one. Totally essential. All right, so here's the absolute heart of the problem. Normally, your nerves are this perfect dance of go signals and stop signals. But with tetanus, the toxin gets to your spinal cord and it literally cuts the brake lines. The relax signal is blocked completely. So now only the contract signal gets through, which means your muscles are just stuck in a state of constant nonstop activation. And you can imagine, right? When a system has absolutely no brakes, the results are just devastating. And they are unmistakable. The signs of tetanus are truly like nothing else in medicine. And here's the truly cruel part. The toxin doesn't touch your consciousness. It doesn't affect your ability to feel. So patients are 100% awake and aware through all of this, experiencing unbelievable pain as their own body and their own muscles just violently betray them. The first sign, and the one everyone's heard of, is trismus. We all know it as lockjaw. The huge muscles in your jaw just clamp down with so much force that it's impossible to open your mouth. You can't speak, you can't eat, it's just locked. Then you get one of the most chilling signs in all of medicine, rhisis sardonicus. This is when the muscles in the face start to spasm, pulling the lips and eyebrows back into this fixed, unnatural, really eerie-looking grin. It's this awful, macabre mask of a smile, but the person behind it is in absolute agony. And as that toxin's grip gets tighter and tighter, it can trigger something called opisthotonus. This is a violent, full-body spasm. The muscles in the back and the neck contract with such incredible power that the person's entire body is forced into this rigid, backward arch. We're talking about a force so strong it can actually break bones. And it doesn't stop there. It's a domino effect that just ripples through the entire body. The abdomen becomes as hard as a board, swallowing almost impossible, and the whole nervous system is on a hair trigger. The slightest sound, a bit of light, even a gentle touch can set off another wave of these horrible spasms.
Okay, so you've got these absolutely terrifying symptoms. How on earth do doctors figure out for sure that they're dealing with tetanus? Well, it's a race against time, and the answer isn't in a test tube. It's all about careful, clinical observation.
And this might really surprise you, but it's a critical point. There is no blood test for this. There's no scan, no lab result that can pop up and say, yep, it's tetanus. The diagnosis is almost entirely clinical. It comes down to what the doctor sees and hears from the patient.
So clinicians basically have to become detectives. They're looking for the clues, right? Was there a recent wound? Do we see the classic signs like lockjaw or that awful grin? There's even a weird test with the gag reflex where the patient bites down instead of gagging. They have to piece all this evidence together, all while making sure it's not something else that just looks similar. The second that diagnosis is confirmed, the fight is on. And I mean, it is a full-on, multi-front war. It requires an immediate, aggressive, and really comprehensive medical counterattack.
The battle plan is basically a 5-step attack, and every single step is non-negotiable. Step 1, you've got to neutralize the toxin that's already floating around. 2, clean the wound, get to the source. 3, stop the bacteria from making any more poison. And while all that is happening, you're desperately trying to control the spasms and, most critically, protect the patient's ability to breathe.
Okay, so the very first move on the chessboard is to give the patient tetanus immunoglobulin. You can think of this as an infusion of special ops antibodies. They go on a search and destroy mission to find and neutralize any toxin that's still free-floating in the body. Now, it can't fix the damage that's already been done, but it can stop things from getting any worse.
So what else is in the medical toolkit? Well, you've got antibiotics like metronidazole to shut down the toxin factory to kill off the bacteria itself. You're using heavy-duty sedatives to try and get those awful spasms under control. And because those spasms can literally clamp the airways shut, patients almost always need to be intubated and put on a ventilator just to keep them breathing. Look, tetanus is a terrible, incredibly painful, and often deadly disease. But here's the most important thing to remember. It is almost 100% preventable with a vaccine. This entire nightmare, this hijacking of the nervous system we've just talked about, it can be avoided. Which really just leaves one final, very important question for you to think about. Is your protection up to date?